Thank you for accepting this abstract. I'm sorry we can't be here in person. And on behalf of my co-authors, I'm pleased to present the long-term safety findings in both men and women treated with onabotulinumtoxinA. And this is a pooled analysis from 5 different trials. This slide shows my financial disclosure. So what is our rationale in studying? So we know that we have a good number of clinical studies giving long-term data evaluating repeat treatment with onabotulinumtoxinA, the treatment of overactive bladder. But the issue is a lot of these studies have had small numbers of male patients. So because of that, the interpretation of the results in the male population is difficult. So the study aim today is to evaluate the long-term safety of repeated doses of onabotulinumtoxinA for the treatment of overactive bladder. By pooling this data, we can look at a sufficient number of male patients from all of these trials to get a better sense of what happens long-term. So these are the 5 trials we looked at. This includes the 2 registration trials that allowed the drug to get FDA approval. This includes an extension trial, a phase 3B trial, and a phase 4 marketing trial. All of these studies were done in North America and Europe. And to enter the trial, patients had to have overactive bladder with urinary incontinence that was inadequately managed by at least one anticholinergic. Inadequately managed means either the patients did not tolerate the medication or they did not have appropriate effectiveness. Now, if the patients got placebo, remember in the first session, they were able to get a subsequent treatment in the open label trial 12 weeks after treatment. And for those patients, their first treatment was their first treatment with onabotulinumtoxinA. And when patients were able to get repeat treatment, they qualified for repeat treatment when they had at least 2 urgent incontinence episodes over a 3-day diary and a PVR of less than 200 milliliters. So what are the outcome measures? So when you look at data is presented by the patient's treatment cycle with onabotulinumtoxinA. And remember, if they got placebo first, their first treatment cycle was that first treatment of onabotulinumtoxinA. And we're looking at the adverse events of interest for the first 12 weeks of each treatment cycle. And now, because there were fewer than 20 male patients after 5 or more onabotulinumtoxin treatments, we're going to look at data for the first 4 treatment cycles. And so this gives you an idea of the patient disposition. And as you can see, at treatment 1 on the male side, there were 133. And again, we stopped after 4, where we had 33 patients. And as you can see, and why we're pooling this data, there were a lot more women than men were involved in all of these trials. So looking at this side, here are the urologic adverse events of interest. And if you just look overall, repeat treatment with onabotulinumtoxinA had a very acceptable safety profile in both men and women, and it was consistent over all treatment cycles. And just as importantly, there were no trends indicating any new safety findings in men with long-term use. You can see that hematuria did occur at a higher incidence in males. UTIs did occur at a higher incidence in females, and all male patients were able to void spontaneously. And in fact, only one patient was unable to void, and that was one of the 1,071 female patients involved in the trial. So urologic adverse events of interest were similar over all 4 treatment cycles. And if you look at it in both men and women, males and females, these urologic adverse events did not increase over repeat treatment cycles. And if you look at there was an observed higher incidence of hematuria in the male patients and UTIs in the female patients. And our theory is this is related to just anatomical differences. Hematuria likely related to the longer urethra in males in the prostate when placing the scope, leading to the increased incidence in hematuria and increased UTI in the female patient, just because increased risk factors such as a shorter urethra, various types of birth controls, and menopause playing a role. You look at the incidence of urinary retention, it was low. ranging across cycles from 1.6 to 2.3% in females and 1.6 to 6.1% in males. And I want to emphasize that the terminology that was used when we started this trial probably is a bit suboptimal because it actually wasn't urinary retention. These patients were all voiding. Like I said in the slide prior, only one patient is actually a female patient was in urinary retention. These are patients that required to start catheterization. And the idea and that plan was you started catheterization if you had a residual over 350, or if you were symptomatic with a residual between 200 and 350 cc's. And the thought is the higher incidence in men is probably just due to the fact that men have prostates, and that's going to impact the potential issue with urinary retention. So to conclude, botulinumtoxinA was well tolerated for the treatment of overactive bladder with urinary incontinence of both men and women. The pooled analysis included the largest reported long-term follow-up of men treated with onabotulinumtoxinA, and with long-term follow-up, there were no new safety issues observed in either male or female patients. Thank you very much, and I look forward to any questions you may have.